Hello everyone. Okay, question of the day. Have you ever watched the CSI or Criminal Minds series that blown you away with how they conduct the autopsy? If the answer is yes, then we are the same lead. The autopsy techniques have been developed to a very high standard in many hundred years, but still they have some obvious limitations, such as certain parts of the body are not being able to investigate it, like in the limbs, the back and the neck. And also, the autopsy procedure disturbs the normal body anatomy, and even some of them may have ethical and religious objections. And thus, many people start to find out many other ways to help them with their investigation, including using the modern diagnostic imaging techniques. The differences between clinical and post-mortem radiology, such as movement artifacts or radiation overdose, is not a problem in the latter. The focus of the forensic investigation is different from clinical practice and include consideration of the injury mechanism. Hence, a forensic radiologist must first be educated in both radiology and forensic pathology and preferably work in cooperation with the pathologist to perform an autopsy. Multi-detector computed tomography or MDCT is one of the most used radiological modalities in modern forensic imaging. PMCT or post-mortem computed tomography is an extensive use of MDCT. MDCT uses a computer to generate an image that are saved in icon format. MDCT is based on the principles that the density of the tissue can be measured by calculating the attenuation coefficient when an X-ray beam passes through it. The body is then examined when the direct exposure of X-rays via a rotating tube. There are many uses of CT scanning in forensic autopsy. The first one is determination of identity. Bodies may be unrecognizable due to external factors such as fire, severe trauma, or putrefaction. In these cases, CT may be a great help in establishing the identity. The identification process is based on a comparison of post-mortem and ante-mortem descriptions and may be registered in Interpol identification forms.
These contain general characteristics of the disease such as sex, age estimate, height, and some specific characteristics such as scars and implants. Most of the relevant sections in the Interpol forms can be filled out from the CT investigations, which has the additional benefit of providing a permanent objective record of the findings. Some characteristics such as the shape of the nose or ears may be even better appreciated from CT images because of their natural appearance.
Whereas in gunshot cases, the primary aim of the radiological examination is to localize the projectiles and fragments, to determine the bullet strikes, and to evaluate extent of damage caused, with the ultimate aim to reconstruct the event. The evaluation is much easier in 3D image CT scan than in 2D plain radiograph. This because it is easy to create an overview of the distribution of pellets in shotgun lesion and localize projectiles and fragments from single projectiles gunshot lesion.
When a projectile penetrates the body, it delivers energy to the tissue. The amount of destruction is proportional to the amount of energy delivered. A projectile produces a permanent channel in its path and produces a temporary radial displacement of tissue. High-velocity projectiles produces a very large temporary polarity that may cause tissue damage at a distance.
CT is well suited to detect abnormal gas collections such as pneumothorax, pneumodiatinum, pneumocephalon, and air embolism. Air embolism may occur in various forensic settings such as head trauma, diving accidents, stab wounds, gunshot wounds, and traumatic pneumothorax. There are many other advantages of CT scan that contributes to the finding by providing an information that could not be obtained by an autopsy alone, and this allows investigation of anatomic regions that are not easily available by autopsy. And take note that an autopsy cannot be conducted in those few hours or episodes like the one that we watched in CSI, but it requires a lot of effort in it. Okay, so I hope you enjoyed the video and you can get many new information and knowledge about it. And thank you for watching. Let's watch CSI together.